We have a question that we received from an audience member earlier. Jeff asks, how do you know if your lung cancer treatment is working?
So there are a lot of ways of knowing if treatment is helping. So the one I rely on the most is, does the patient overall feel better? That is difficult to say exactly how. Sometimes people are having breathing problems. They feel that that's better. Sometimes their energy's lower. They feel better. It can be vague. We also use scans. So we tend to get scans depending on the treatment we're giving every couple months, plus or minus, sometimes every 3 months, to help track what's actually going on. But occasionally there are discrepancies. So sometimes the scan, it's, is it better? Is it not better? Can't really tell. And then you always taking that, how does the patient feel? So usually if the scans are better, the patient feels better, it's easy. Usually if the patient's feeling worse, the scan looks worse, clear decision. Not a good one, but it's clearly we need to do something different. Mm-hmm. Yeah. But sometimes you're left, and especially this happens with the first scan, because you get a scan, takes a little while, you start the new treatment, then you get the next scan. How much of the changes happened before you started the new one and how much didn't? So these can be more challenging conversations, but generally if the patient's feeling a little bit better, the scan's unclear, we usually say, let's give this treatment a little bit more time. We also, I think your question was specifically around how do we tell if it's working, but you also need to be thinking about, well, what's it doing that's negative to the person? And is that potential, those side effects worth the benefit we are or are not seeing? So it's kind of all of those things together. It can be a bit complex.
Yeah. What goes into the decision to change therapies if it becomes necessary?
So when we're thinking about making a change, the way I always look at it is where we are today still okay or not? And if it's not, that would be because clearly the cancer is growing or clearly the side effects are just not tolerable. Then we decide together with the patient, we need to do something different. And when we think about what do we do next, we look at what have we already done? Did it work or not? If not, let's do something more different. If so, let's think about something that might be somewhat similar. When we're dealing with targeted therapies, we have ways to try to figure out what changed in the tumor that made it now resistant or not working with that treatment. And so with some of the pill drugs, there's been a lot of research in understanding how does the tumor change that helps it evade, get away from, be resistant to whatever treatment you're on. And then sometimes we have other pill drugs that work in that particular setting, not always. With immune therapy, we're trying to better understand why does the immune therapy stop working. Sometimes you can add back to it, like you can add chemotherapy back to immune therapy alone, or sometimes we can do radiation with immune therapy to get that response back, or add other combinations to it. So that's another thing that we're working on. And then we look at, like I said, if someone hasn't never had chemotherapy and the tumors become resistant, we're going to be thinking a lot about chemo because that can play a role against so many different reasons that the cancer might not be responding to whatever treatment someone's on. Mm-hmm. And then also looking at how the patient's feeling and doing, what's their overall, what we call performance status, their sort of overall health, and how well do we feel with them that they're going to be able to tolerate the next treatment? Because you're always having to weigh how much is this likely to help and how might this harm, and finding the right balance.